Alright, now you see me here at the end of the table. I'm sitting down and I'm pointing at the thoracic ducts over here. These lymphatic ducts drain the whole body. This one, for example, the upper right corner or quarter, this one for the rest of the body. And it's important to get the fluids into these ducts. So to do that, we're going to start immediately, and this is what we're going to do. Slowly, we are going to go in and towards the lymphatic duct. Again, it's like a triangle. Let me exaggerate that. It's like this. That's what we're going to do. So towards the trunk, down a little bit, and then definitely towards the thoracic duct. Pressure is like 1, and you're just going to move in, immediately going out laterally. It's kind of laughably light. The client won't feel anything until after the session, really. And what I'm doing is just moving the skin, but I'm not gliding like an effleurage. See? And you do that about 5 times, okay? Not more than 5. Then you're going to go next to the trachea and do the same thing, again proximal to the thoracic ducts and that. And you're going to move in like a curvature. Let me exaggerate that, like this, always like that. See how I move up? Do not worry, you will not occlude any arteries, carotid, jugular. No lymph nodes will be squeezed out of proportion. And very slowly you move up to the neck, away from the ducts below in the trunk. Then the next one you're going to do is you're going to start again proximally. This will be in line with the SCM and that. And you again see, you can go a little bit slower. So it's in a sort of semicircle. Notice I'm using 2 fingers to cover a large area. Now I'm getting my speed just right. Okay, 5 times, maximum 5 times, minimum 3 times. See? Then under the chin, submandibular glands and that, we're now going to go this way and that way. Again, this way and that way. And there. It's very subtle, the movement. Again, down and then like that. I'm not gliding. I'm not doing any effleurage at all. This is, when you get to the submandibular glands, which are usually swollen when someone's coming down with something, just before a cold sets in. This is really great. And of course, doing the face and shoulder girdle is great for yang edema. But you should always add that on in yin edema as well, because that will eventually creep to the face if nothing is done about it. Look, I have my fingers in the endangerment area where the carotid is and all that. Nothing's going to happen. Now we go to the face, and we're just going to go and do a semicircle that way. So notice the direction, always towards here, the thoracic ducts. There you go. And then move up the nasolabial groove. I'm using just 2 fingers, that's the space allowed. On the side of the nose, you're going to go 1, 2, 3 and stretches. Let me illustrate. 1, 2, 3, no gliding. 1, 2, 3. And of course you do this bilaterally. Now what's left? Well, now you can go to the near the temples, behind the eye, and just see that, cover the temples like that. Now under the eyebrows you're going to do a stretch. Let me illustrate that. Your finger is under the eyebrows on what you call the orbit of the eye, the actual bone, and just stretch it a little bit. There might be a little bit of gliding. And then again the same is repeated by going above the eyebrow. I'm going to show you another technique for the trunk, and you can do that on the leg. That would be the wave. Basically what you can do is, it's like this, like a little caterpillar, like that, alright? So you're going to start immediately, and you're going to push a little bit like that. See? Very light, super light. You can alternate this, you know, do one strip with the caterpillar to get a minimum of 3 reps or repetitions, up to 5 maximum. See? Going slower. Notice, although you see the indentation, it's still 1, maybe 2 out of 10. So the focus is on the 2 thoracic ducts over here. It'll go then via the capillaries and flush out. Always downwards, quickly over here on the inside, next to the trachea and esophagus, down like that. On the SCM and that, downwards. On the chin, it'll go laterally down like this. So let me exaggerate that. On the nasolabial groove, downwards, notice the hook, okay? So never up. So it's a semicircle or a triangle without a base. Stretches, you just stretch the skin this way, that way, that way. See, just stretch it, stretch it, stretch it. For oils, I will use skin tone or baby skin, depending on what issues are on the face. And you lightly just, as I will show you in the course, you put a drop and just rub it into the finger pads and it'll disappear. They will not burn the skin, alright? So that's an additional thing. Then finally for the head, you can then finish just doing a light 1 out of 10 squeeze like that. And of course that takes it down, 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 like that. So let me show you again. Just cup the head and just go down, 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 down like that. That's a good speed. In fact, with hardly any speed at all. Down the sides of the face and into the neck area. So that will be the manual lymphatic drainage. And then what I usually do is I usually finish off like that. Third eye and the trunk and stomach. So then we finish treating the client holistically. And so we finish now, and I hope to see you then in my next class. Thank you.